Now, last week, eNCA reported that prescription medicines were being sold illegally on the streets of Cape Town. The SA Health Products Regulatory Authority has now joined police to investigate the reports. It says 2 suspects, a man and a woman, were arrested and charged with contravening the Medicines and Related Substances Act. Mokgadi Fafudi is the compliance manager at Sahpra and joins us now. Mokgadi, thanks very much indeed for talking to us. Perhaps let's start with the arrests and what we know. How did those suspects get hold of prescription medication? I mean, do we know where it came from at this stage?
Devan, because this case is currently under investigation, it's undergoing law enforcement route. There isn't much that I can disclose, but what I can say is that these medicines were made available on the street to patients and to ordinary citizens. And in terms of establishing how this got into the hands of these people, it was mentioned amongst others that some of the sources are the facilities that are legitimate in holding medicine, such as the hospitals that are in the surrounding area and the clinics in the surrounding area, together with other unidentified sources. So it looks like there are various role players in this. So in the meantime, the law enforcement, together with ourselves, we are still working to find out what is the source of this problem.
Can you tell us what sort of medication was found? I mean, presumably prescribed medication can be lethal to a person if it's not prescribed by a doctor.
Indeed, Devan, what is concerning is that amongst the medicines that were confiscated, it was highly scheduled medicines. These are high-risk medicines with the potential for abuse, dependency, and addiction. So we're speaking about your severe pain medication that are highly scheduled and highly controlled. They can only be accessible in a pharmacy through a doctor's prescription in specific quantities. So these were original packs of medicines with packs of hundreds, for example, of tramadol. And there were also other scheduled substances for chronic use for pain management. There were anti-inflammatories that were found. There were corticosteroid ointments that are used for anti-inflammatory conditions such as your eczema and psoriasis and many other anti-inflammatory conditions. And also found were some anti-inflammatory tablets, some nasal sprays that are used for chronic conditions such as allergic rhinitis. However, most of these substances should be sold via a doctor's prescription. But very concerning is that when the inspectors were on the scene, they were shouting, these hawkers were busy shouting, tramadol, tramadol. And this is a highly regulated substance. It's an internationally controlled substance. So that is why it is concerning that such a substance is available in its original packs to the street, to the public. So this is the most concerning part of this.
And one certainly hopes that the source of that will be tracked down. I'm wondering what prompts individuals to buy these medicines. I mean, isn't the issue of it being more affordable on the streets to people who don't have health insurance, for example? Or is it perhaps just a result of addiction or maybe a further secondary business that's unfolding?
It can be various factors and also misinformation. But what I would like to plead to the public is that these medicines are accessible free of charge under the conditions that are safe, because there are health practitioners, there are facilities that are authorized by government, and also, of course, with the private sector. Those who cannot afford it, government does offer this for affordable, let me say for free for those who cannot afford, through the clinics, through the hospitals, and through other pharmacies. So people must go through only to the facilities that are authorized by government or authorized through the Department of Health Sahpra or even the Pharmacy Council, information is available in this regard, but people should not go to hawkers. They should not go to facilities that are not licensed and where health professionals are not available to access medicines, because medicines are not just commodities. These are health products that must be first authorized, because they are evaluated in terms of quality, safety, and efficacy. So they are registered and they will be authorized, and they must be through the pharmacies or authorized facilities. And in those establishments, there will be professionals who are trained to issue those medicines. So these are not safe, because if medicines are not through the correct supply chain, their safety is no longer guaranteed.
Yep.
Their quality is no longer guaranteed. And the healthcare professionals will ensure that they are treating the correct disease, and they will be issuing the correct patient with the correct quantity of medicines that are applicable and the right dosage. So these people are also misinforming the patients or the public as to what these medicines are for, and for duration, what are they taking for how long. So they are not professional, they are not trained to issue such
if I can just step in there
advice.
with the limited time that I have left, Mokgadi, just very quickly, if the public stumbles upon this, what's the first move they should do to report it?
Okay, on the Sahpra website, the spelling of Sahpra is what appears behind me. So on the Sahpra website, we do have a channel for laying complaint. So people can lay a complaint through that, or they can email me. My name is Mokgadi Fafudi, so my email address is mokhadi.fafudi@sahpra.org.za. And we will be able to investigate this matter. So we will ensure that the public is safe. We will investigate each and every complaint that we receive, and we treat this highly, we prioritize this because the public safety is Sahpra's concern.
Yeah, no, absolutely.
Thanks, Devan.
Thanks very much indeed. Mokgadi Fafudi is the Compliance Manager at Sahpra.